Hi, beautiful people. So this is going to be our presentation. In our group, it was Andrew, Carly, Jenny, and I, Nicole. So we are talking about the trauma within the homeless population today. Okay, there we go. So trauma in the homeless population, it's really just like, it's not just, I feel like a lot of people think about it very surface level and not necessarily understand the causes and effects behind homelessness. So, homelessness is not simply just a lack of shelter, it's a more crucial, kind of complex issue. A lot of traumatic experiences lead individuals to come to this point, and studies have consistently shown that individuals who experience a higher level of childhood trauma are more likely to become homeless later in life. Childhood trauma can set the stage for a range of challenges, such as like difficulties forming stable relationships, keeping stable relationships, maintaining stable employment, stability overall, really, and coping with stress, all contribute to the matter of becoming homelessness. And then once individuals find themselves in the situation of being homeless, they're kind of helping cope healthy coping mechanisms, they just kind of like go out the window. Like it's so hard to be homeless and have like healthy coping mechanisms because you're just surrounded in a lack of stability and you don't have like a safe and stable place to call home. So individuals who are at a heightened risk of experiencing like symptoms of PTSD or developing PTSD. They're more able to be physically assaulted and sexually assaulted while on the streets or in shelters. And then furthermore, like after this, the cycle of trauma and homelessness kind of just like goes on, and it becomes just a repeating cycle until people are able to just be able to get out of it and find stable housing, or they just find themselves stuck in the cycle.
Homelessness is surrounded by trauma. Not only does it cause trauma, but it can also be the result of trauma and kind of everything in between. Psychological disorders and mental and physical health problems are often the result of traumatic childhoods, and people that experience trauma in childhood, such as insecure attachment styles within the family, isolation, and physical and emotional abuse, um, that have these mental health problems often struggle to hold down a job or remain consistently financially stable. This leads to the rate of people in the homeless population having a much higher probability of having experienced trauma in childhood. There is also a large correlation between childhood trauma and drug dependencies with violence, which often leads to homelessness as well. Homelessness itself can also be very traumatic. Occurrences of physical and sexual assault greatly increases with homelessness, as well as access and opportunity for substance abuse. People in the homeless population lack resources available to them that would help create healthy coping strategies after these traumatic events occur, which can lead to worsening symptoms as well as the development of new symptoms. Because of the social and economic disparities faced by people that are homeless, they often hesitate to seek out the treatment that is available to them as well, such as an emergency department. They often wait until it is absolutely necessary to do this. People that are homeless are more likely to be admitted to the ED as a result of assault, self harm, penetrating injuries, as well as psychiatric admissions. They are also more likely to have a high blood alcohol concentration and leave the hospital against medical advice. This often leads to medical debt as well and can keep people that are homeless from recovery, which leads to more trauma, keeping people trapped in the cycle of homelessness without a clear way out.
Homelessness continues to be an all-encompassing pathology, with higher rates of suicidal ideation, domestic violence, sexual violence, and brain injury than the general population. Practitioners need to adapt interventions to fit the unique challenges that come with being homeless. One of these ways is to implement trauma-informed care, or TIC, principles. TIC is a philosophy that argues for the importance of understanding the trauma and life experiences of a patient before they can be most adequately helped. Though most often applied in psychotherapeutic settings, the philosophy of TIC can be applied in a wide variety of fields, including political and economic ones. As far as politics is concerned, researchers have gone as far as to argue that it is only when policymakers begin integrating TIC principles that we will begin to see the positive changes in the homelessness community that we long for. TIC can take many forms. For example, one can integrate trauma-informed care by applying trauma-informed design, TID principles. TID entails designing the physical space of therapy offices and homeless shelters to assist in the therapeutic process by creating a level of comfort in the participants involved in the care being provided. According to one study, conscientiously designing physical spaces so as not to elicit a traumatic response has been shown to improve therapeutic outcomes. Therefore, TID could be efficacious in the treatment of those within the homelessness population. Forgiveness therapy has also shown to be effective as well. The goal of forgiveness therapy is to facilitate interpersonal growth by emphasizing forgiveness. One study found that forgiveness therapy ameliorated feelings of depression and anxiety. The therapy can be best applied in situations where the participant is trapped in maladaptive life patterns due to internalized anger and resentment. These are just a few of the ways in which TIC principles can be applied to improve therapeutic outcomes. As previously mentioned, it is crucial that policymakers and therapists everywhere account for the unique and traumatic experiences that come with homelessness if we are ever to see the psychosocial improvements that we so long for.
So, in conclusion, we know that homelessness is much more than a lack of shelter. Homelessness and trauma go hand in hand. There are many complications that occur with homelessness, such as substance abuse, mental illness, psychological distress, depression, self-harm, suicide, and death, accidental or not. Individuals who experience homelessness often have higher ACE scores than others. There are so many reasons a person may experience being homeless, such as mental health issues, substance abuse, domestic violence, sexual abuse, a lack of funds to obtain affordable housing, and very rarely, some are homeless by choice. People who are without homes are at a greater risk for being a victim of any number of circumstances. Homelessness comes from trauma and causes trauma. Homelessness cannot be without trauma, and the traumatized victims of it cannot be helped without our help. Affordable housing, more homeless shelters, drug rehabilitation services, psychiatric care, and outreach are all things that we should be working on as a society to help this problem. Thank you very much.